Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. When you're in labor, one of the things people worry about the most is their baby's heart rate. Today we'll be talking about everything you wanted to know about your baby's heart rate during your labor so you can understand why monitoring is so important. So click those like and subscribe buttons and stay with us. Let's start with the basics of fetal heart rate. One of the things that you guys should know up front is that a lot of what I'm going to discuss in this video really makes more sense to the healthcare providers. But I'm trying to give you a peek into why we pay so close attention to your baby's heart rate during your labor and delivery. So your baby's heart rate varies depending on their gestational age. The range is usually 110 to 160. It's usually slower when a baby is 40 weeks versus faster when a baby is 24 weeks. So it really does vary. Baby's heart rate should increase with your contractions and then return back to normal afterwards. And finally, there should be variability or movements and fluctuations in your baby's heart rate. This is considered a good thing. Your baby has a baseline heart rate that we look at. This is the average of the rise and fall that we see normally in your baby's heart rate. When we see a rise at least 15 beats above that normal for 15 seconds long, that's called an acceleration. This is normal and healthy. It shows your baby has very good oxygenation. These can occur spontaneously, and we really love to see them. Now, sometimes over time, your baby won't have any more accelerations. So we try to encourage them by either giving you IV fluids, which is why we want to have an IV available, or sometimes we'll rub your baby's scalp up through your cervix. There are 3 types of decelerations or drops in your baby's heart that you should know about: early, variable, and late. Early decelerations are caused by the compression of your baby's head during a contraction. This stimulates their vagus nerve and creates a vagal response, which causes a drop in their heart rate. Early decelerations are usually not a problem. Please remember to hit the like and subscribe buttons so you can get our latest content. Variable decelerations are irregular, jagged dips. They look dramatic on the monitor. In fact, a lot of times they look like a V for variable. This happens when the umbilical cord is temporarily compressed. It's very common. In fact, oftentimes your baby can grab their umbilical cord and squeeze it, causing a variable. Your baby needs a steady flow of nutrients and oxygen. And so when the cord is compressed, they're not getting those things. Variables over time can be a sign of reduced blood flow, and eventually they can be harmful. Late decelerations don't begin until the peak of your contraction or after your contraction is finished. These are smooth, shallow drops in your baby's heart rate that mirror your contractions. When we see accelerations at the same time, late decelerations might be okay. But when late decelerations are present with a fast heart rate or tachycardia, or the variability, this is the fluctuation in your baby's heart rate, is not there anymore, this is a very bad sign. This means the contractions that you're having are depriving your baby of oxygen, and an emergency C-section might be required. A home Doppler is a machine to listen to your baby's heart rate at home. These machines are not recommended by the FDA, because we don't have any evidence about the long-term effects of their safety, and it is possible they could pose a risk to your baby's development. These machines work by sending sound waves into your uterus that bounce off of any movement that they detect. The thing is, this sound heats up the tissues around them, which is why it may pose a risk to the baby. Now, one of the biggest things with these Dopplers is they can create a false sense of panic. This means you can't find your baby's heart rate, you assume it's not there, and you rush to the hospital thinking there's been an emergency. But more importantly, and more sad, they can create a false sense of security. I hope this video has shown you that fetal heart rate monitoring should be left to healthcare professionals. When using a home Doppler, you may think that you are hearing your baby's heart rate, but in fact, you may be hearing your own, and the heart rate may not be there. If you don't know what to listen for, you may actually think the baby is fine, when in fact, we need to be checking you because there could be an emergency situation. I hope this video has helped you learn all about your baby's heart rate and why it's so important that we monitor it during your labor. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.